Hello, my name is Ayla Achad. I'm a West Virginia registered nurse, past president and second vice president of the West Virginia Nurses Association, the voice of all nurses in West Virginia. My current practice, and for 35 years, my practice has been in the area of health promotion and wellness. Right now, I'm an author, speaker, and health coach. In this brief presentation, we want you, our legislator, to know that we support your massive effort to restructure the healthcare system in West Virginia. We have three things we want to share with you. First, information and insights on nursing and health reform in West Virginia. Second, a way to simplify health reform legislation. And third, expertise from nursing leaders in your district. Health reform calls for a change in paradigm from a focus on illness to a focus on health. In effect, turning the healthcare paradigm upside down. For this reason, President Obama has laid out a plan for health reform to change our focus from a disease care system to one that focuses on wellness and public health. If this passes, this plan will open many opportunities for nurses who are educated and prepared to step into expanded roles. You may not realize nursing is an independent health profession, legally documented in its scope of practice, which is different from, yet collegial with medicine. Nurses are health educators who focus on helping people get and stay well. They are person-centered rather than illness-centered in their approach to health care. Nightingale documented in her Notes on Nursing in 1825 the ways that people get and stay well and how nursing interventions help them to do that. This is the foundation of modern nursing. Today, nurses continue to document outcomes from nursing interventions in the National Database on Nursing Quality Indicators. Healthcare reform calls for services conveniently delivered where people live and work. Workplaces, schools, communities, homes, and on the phone and internet. These are the settings that nursing's healthcare reform pioneers created and the areas in which nurses are expanding their roles. Lillian Wald pioneered health reform in communities. Her efforts were the beginning of public health. Today, primary care nursing centers provide health care conveniently to families in their communities. Two West Virginia nurse practitioners, Martha Cook Carter and Lisa Del Porto, opened Women Care Birthing Center in 1989. They then opened Family Care Primary Health Care Center in 1997 to provide primary care to families in their community. West Virginia has 540 advanced practice nurses, or APNs, better known as nurse practitioners. The American College of Nurse Practitioners says that nurse practitioners are qualified to practice without physician supervision and can open their own private practices. Lillian Wald also instituted the first nurse in a school setting in 1902. Within 1 year, school nurses were able to reduce students excluded from school with communicable diseases from 10,567 to 1,101. School nurses get results. Today, 242 certified school nurses serve 281,297 students in West Virginia's schools. School nurses are highly educated, having both a BSN, Bachelor of Science in Nursing, and a CSN, Certification in School Nursing. School nurses educate students in health practices, conduct health screenings, and increasingly provide primary and chronic care to an increasing number of health-challenged students in West Virginia schools. West Virginia nurses are making inroads into childhood obesity with their partnership with the Cardiac Project, which helps to reduce the incidence of diabetes and heart disease in West Virginia. Nurses also reduce health costs in the workplace. A recent survey reports 61% of workers would prefer to get their health information from a health consultant or workplace nurse. Occupational health nurses reduce absenteeism, increase productivity, and cut healthcare costs. Additionally, research shows that when employers institute a 24-hour nurse line along with an internal information campaign, they can expect that nurses will refer 60% of those calls to cost-effective, lower levels of care. This is a substantial cost savings to employers. Mary Breckenridge reformed women's health when she educated her nurses in England to become nurse midwives and formed the Frontier Nursing Service in 1925. Frontier Nursing Services significantly reduced maternal mortality rates and low infant birth rates. Today, nurse midwives like Angie Nixon provide safe, effective, cost-effective health care to pregnant women and mothers and babies. Angie's one of 59 certified nurse midwives who delivered 2,863 babies in birth centers, rural hospitals, and tertiary care centers. This is 13.7% of the births in West Virginia. Today's midwives meet well women's needs throughout the lifespan, from adolescence through the senior years. The West Virginia Healthcare Planning Commission included nurse midwives in its comprehensive reform plan, saying, "We affirm the value of nurse midwives as primary providers who are improving access to care. Third-party reimbursement is mandated in West Virginia for certified nurse midwives, as is Medicaid reimbursement. Concerned about the quality of life and care at the end of life's journey, another nurse, Dame Cicely Saunders, advanced the concepts of palliative care and hospice services. West Virginia was one of 17 states to receive funding from Robert Wood Johnson Foundation for end-of-life issues. Because most healthcare dollars are spent in the last few months of life, we all need to be concerned that we get just the care we want and the care we need at this important life transition. Citizens are increasingly turning to the internet for health information. In 2007, 56% of American adults, over 122 million people, sought healthcare information from someone other than their physician. The proportion of seniors accessing the internet for health information was 18% in 2007. Currently, McGill University School of Nursing is piloting a program to deliver services to seniors via the internet. Health reform calls for accessibility and affordability. Nursing is the largest health profession with 2.9 million nurses nationwide, 23,500 of them in West Virginia. West Virginia ranks 7th in the nation in the per capita employment of 6,560 licensed practical vocational nurses. Nursing is cost-effective. The national median salary for primary care family practice doctors is $147,516. Nurse practitioners average $87,400. Primary care BSN nurses average $63,000. Primary care LPN nurses average $47,000. And certified BSN school nurses are a healthcare bargain at $43,053. 80% of healthcare spending in West Virginia is for chronic care. Research shows that outcomes for chronic care are equivalent between physicians and nurse practitioners, and patient satisfaction outcomes are higher with nurse practitioners. It's important to note when framing healthcare reform legislation that the number of primary care physicians is declining nationally and in West Virginia, while nurse practitioner numbers are increasing.